Okay, go. Hi everyone, welcome back to the AM virtual event, day 5. I am Georgia, Deputy Editor of Aesthetic Medicine, if you don't know by now. If you do, then you've had to listen to me say that over and over again, and I apologise. I'm joined again by the lovely Dr. Vincent Wong. Vincent is here today to talk to us about the Tesla Forma functional magnetic stimulation device for body contouring. So, so Vincent is an aesthetic practitioner at Vindoc Aesthetic Academy, which is his own training academy for aesthetics as well. But he's here today on behalf of Tesla Forma. So, as always, any questions that anyone has, pop them in the Q&A box. They'll be moderated, and then I will come back on at the end and I will ask Vincent your questions, and we'll do a bit of a Q&A session. So Vincent, if you're ready,
yes,
I will share my presentation. So hopefully it should all run smoothly. I'm going to turn my camera off, and then I'll put back on at the end.
Cool.
Thank you.
Let me just do that. Okay, good afternoon everyone, and welcome to the session. So my name is Vincent, and today I'll be talking about functional magnetic stimulation with the Tesla Forma device. So before I start, I would like to take a few minutes to actually go through our body. So our muscles obviously give us our body space and the main function of our movement. There are 3 different muscles. So we have skeletal muscle, cardiac muscles, and smooth muscles. For this presentation, we will be focusing on the skeletal muscle, which are the voluntary muscles. Okay. So muscles have a few unique characteristics, so they can relax and contract very easily. So a good example of this is during pregnancy and childbirth. Obviously, as I've said earlier, the main function of muscles is for body movements and to give us a shape. It also helps with blood circulation, especially with venous return back to the heart. And it plays an active role in our day-to-day activity, from eating, breathing, talking, everything, you name it, we need a muscle for it. Okay, a bit of revision on how muscles contract. So our brain sends an impulse to the muscle, and the impulse travels through the nerve to the neuromuscular junction. And at this junction, acetylcholine or noradrenaline is released depending on the stimulus. And this basically causes a change in the concentration of sodium and calcium. And this then burns ATP, the energy, and the energy is used to shift the myosin on the actin threads, and that's how you get a contraction. Now, there are 3 different types of contraction. So you have 4 different types, sorry. So you have isometric and isotonic. So isometric is when the length of the muscle does not change. Isotonic is when the length actually changes. And isotonic can then be divided into eccentric, where the muscle lengthens, or concentric, where the muscle actually shortens. A good example is on this diagram here. So by holding a dumbbell, if you hold it at 90 degrees, you will have isometric contraction. If you lower it, you get eccentric contraction. And if you raise it, you will get concentric contraction. So now we're going to talk a little bit about total body muscle simulation using the Tesla Forma device. So in a world of copycats, Tesla Forma is a breath of fresh air. And over the next few slides, we'll go through the uniqueness of this device. So Tesla Forma uses functional magnetic stimulation, and it can be used for muscle strengthening, toning, and sculpting of body areas. As you can see on the slide here, you can use it on a lot of different areas of the body, ranging from abs to back and pelvic floor. So a very short summary about the FMS technology. So this is obviously an external simulation, so it bypasses the brain. So we're contracting the muscle without the brain having to send a signal to it. So the device actually causes rapid changes in magnetic field intensity, and this actually induces an electrical current within the neuron itself, and this is called electromagnetic induction. So with the treatment, usually we recommend 8 sessions to be carried out within a 3-week period. So depending on the patient's schedule, they can have it every other day or 2 to 3 times a week. The treatment is painless, and you can actually do it over the patient's clothes as well. But we'll go through a bit more on that later on. So here is a video just to show the different body areas that can be treated. And as you can see, the muscle contractions are very strong, and you can really get a good result from it. So this video just shows that you don't actually need skin contact for the device to work. And I think this is particularly important, especially in current times and when we go back to work after lockdown. This is very good from a health and safety point of view. So there's no contact with the patient, and it reduces any contamination risk. So now I'm going to go through the differences between electrical muscle simulation and FMS, which is what Tessa Former used. So the key points here are, number one, the increase in creatine kinase. So EMS, some of you may be familiar with sort of like the TENS machines and things like that. But if you turn it up and use it to use and you turn up to use it for muscle toning or body sculpting, it can actually cause a high increase in creatine kinase, which is actually a marker for tissue damage and muscle breakdown. So actually you are building the muscle, but you're also breaking it down as well. Whereas with functional muscle simulation using magnetic field, the increase in creatine kinase is actually very, very low. The other key thing is that with EMS, you get electrochemical degradation near where the electrodes are placed, whereas with FMS, we don't use that at all. The other point is that with EMS, the penetration into muscles is limited. Obviously, that depends on a few different factors. For example, moisture, resistance of the tissue, resistance of the skin, so on and so forth. Whereas, as you saw earlier in the video, with FMS, you don't actually need skin contact, and it actually penetrates about 7 to 10 centimeters into the tissue. So we can effectively reach the muscle. Okay. Now, this is a quick video to show the differences between EMS and FMS on ultrasound. So here, as you can see, the muscle contraction for FMS, it is a lot deeper. The whole muscle is working, whereas with EMS, you're only getting a very slight contraction. And that's what the device looks like. And you can see here, we are on 89% on FMS. And that is not the highest. The highest is 100%, obviously. And even at 89%, you get a very strong contraction here in comparison to EMS. And this is a different phase of the cycle. So as you can see, we have different simulation for different kind of contraction, as we discussed earlier, whether it's isometric or isotonic. Okay, so obviously there are a lot of competitor devices on the market, but most of them are dedicated for aesthetics purpose only, and they do not have dedicated programs for all body areas. They have limited phases and sequences, and some of them are quite uncomfortable for the patient. So with the, I know a few different devices that can treat different body parts at the same time. Now, this may sound very exciting for the patient and for the clinic to start with, but if you think about it, if we want effective 100% muscle contraction, if we have that at different parts of the body, it then becomes quite painful. for the patient. So the unique thing about Testoformer is that we can treat different body areas at different times. But with each treatment, we can get up to 100% the supraoptimal contraction of the muscle. And the other key thing is that we can carry out something called core therapy using the magnetic chair. This is something that I'll go through later on in the presentation. So Testoformer is actually a device that's developed with muscle health in mind. So there are over 200 dedicated programs. So you can use it for aesthetics, or you can use it for pain management, sports injury, gynecology, andrology. It can be used on all body areas. As I said earlier, there are different phases within each program. So this range from 10 to 24 within one session. So this means that it is unlikely to get the plateau effect, whereas with other devices with limited phases, it is very easy to get the plateau effect. The applicators, as you can see in the diagram, they work in alternative patterns. So again, this is from a muscle health point of view. So if we are getting 100% muscle contraction, if we use both applicators together, we'll have to turn the power down because it will be uncomfortable for the patient. So with Testoformer, you get alternative patterns so that when one muscle group is contracting, the other muscle group is actually resting. So it allows for the muscle to rest and recover in between contractions. And with the core therapy, this is a unique treatment suitable for everyone, male, female, young, old, whether you want to increase sports performance or your posture. Core therapy is something that is very unique to Testoformer. It uses a chair and also two external applicators. And we also have large and small applicators, so you can really tailor the treatment to your patient. So this is just a little bit of explanation about the chair. So within the chair, you have two applicators, one in the back and one on the seat itself. And as you can see from the design, it's very comfortable with a full back support, and this can actually help with the posture correction as well. So with the core treatment, core therapy, we are using 4 different applicators. So one in the back, one on the base of the seat, and 2 applicators externally on the abs. So we're working the core group of muscles in one go. And this can be used for gynecology, andrology, physical therapy, pain management, especially those with back pain. And you can also use it to help patients with incontinence as well. So differences between workout and Testoformer. So obviously with workout and going to the gym, we are relying on the brain to send a signal to contract the muscle, and studies have shown that we can only achieve up to about roughly 40% its strength. So we're not getting 100% contraction. Obviously, this changes when you're in the fight or flight mode. So say, for example, if you're being chased by a dog, you probably can jump over a wall that you normally can't jump over. So during fight or flight, you actually get a higher rate of contraction. But with Testoformer, we bypass the brain 100%, so that it is an external stimulus and we can contract the muscle up to 100% of its strength. So this is a kind of contraction that cannot be achieved during regular workout. Of course, we always tell our patients that having the treatment of Testoformer doesn't mean that they stop going to the gym, doesn't mean that they can eat anything they want. So obviously a healthy lifestyle will complement the treatment as well. So here are some before afters. So this is the 49-year-old gentleman. Obviously with age, metabolic rate decreases. So he actually goes to the gym 3 to 4 times a week, and there's no change to his workout patterns. He's using Testoformer to supplement what he's already doing in the gym. As you can see, after 8 treatments, you can get a very good result even at age 49. So obviously, if you have younger patients, the results will be better as well. The Testoformer device can also be combined with other treatments. So say, for example, if you already have HIFU devices in your clinic, you can actually do the HIFU procedure after, or if you have things like cryotherapy, for example, with True Cryo, you can do the cryo first and then do the Testoformer. So it can be easily integrated into your practice. And here's another before after. So this is the buttocks area. 8 sessions, carry out every other day. There's no sports or no diet involved. So this is just purely based on Testoformer. And obviously everyone's muscle is different. Some people may get more dramatic results, and also depending on the muscle strength that you have as a baseline. And this is another patient, again, 8 sessions, carried out every other day. No significant change to the lifestyle or diet. As you can see in the photo to your right, even the back appears straighter because this patient was treated with not just the abs, but also the back as well. So it can really help with posture correction and to balance the body out a little bit better. And here's another one. Again, no changes to sports or diet. Okay, so benefits of Testoformer. So obviously it is painless, non-invasive, no downtime for the patient. You can have different sequences within the same program, so your muscles are always contracted and worked at different levels, different angle, different depths, so you don't get the plateau effect. There are 4 different channels, as you saw earlier with the chair. You could use up to 4 applicators in one go for the core therapy. As I've said earlier, it can work without direct contact to the skin, which I think is very important. And there are over 200 different programs, so you can really mix and match to give your patient a real holistic approach to body sculpting, depending on what your patient wants. So say, for example, I treat quite a lot of bodybuilders, so I use the Testoformer for their aesthetics purposes, so abs and arms, but we also work on the core therapy as well. So I incorporate all of that into a program for them. So you can really offer your patients something that's truly tailored to them. The other thing with Testoformer is that there are no consumables. So once you have the device, you don't really need to buy anything else. So I think that is a very good thing to keep in mind, especially for clinic owners, especially in times like this, where COVID-19 has had a huge financial implications for a lot of us. Okay, so contraindications. So as with all aesthetics procedures, you don't want your patient to be pregnant, or and you want your patient to be fit and healthy. So main contraindications are listed in this slide. So basically, you don't want to treat anyone with a pacemaker or any metal bits and bobs in their body. I always tell my patients to come in their sportswear, because if, say, for example, if they are wearing jeans or any items of clothing with metallic parts such as buttons, so on and so forth, these areas can actually heat up. So I always tell my patients to come in something that's comfortable, like sportswear, for example, so that we can avoid that. If your patient has any piercings, please have to remove it. Obviously, again, metallic parts means that it can heat up. Also, patients with tattoos. Some tattoos are actually made with metallic ink. So if the ink has metallic parts and it's in the direct treatment area of the device, it will actually cause a discomfort in the tattoo area. However, nowadays a lot of inks are actually plant-based, so patients who are new to tattoo shouldn't be a problem. The other thing that Testoformer can do is actually to help with Parkinson's and a lot of different neurological diseases as well. So with Parkinson's, it can actually help to reduce the tremor. Okay, so these are a few common questions that patients ask. So the first one is how many sessions need to be carried out. We recommend 8 sessions, but obviously each patient is different. This can be reduced to 6 or increased to 10. So it really depends on your patient assessment. The other thing is, how does it feel? So it is highly tolerable. Obviously, the patients will be contracting their muscles without them contracting it actively. So there's a strange sensation, but it is not uncomfortable in the slightest. Downtime, obviously there isn't any downtime. It's very straightforward, in and out procedure. Treatments takes between 30 minutes to 60 minutes, depending on what we're trying to achieve, which program we're using, so on and so forth. Okay, so Tessiforma, apart from those that are contraindicated in the slides that we've shown earlier, it is pretty much suitable for anyone, young, old, whether you want to improve your posture, whether you improve your aesthetics look, whether you want to improve your sports performance, or whether you have an underlying condition, for example, incontinence, Parkinson's, it is suitable for everyone. So it's a wide range of patients. So when will I see results? This is probably the most popular question, and probably the one that is most difficult to answer, simply because everyone's muscle is different, and we have different baseline and different percentage of increase with the device. But most of my patients start to feel the change after the first session. And as you can see in the before-after photos, you can see 1 month after, and the results actually improve with time as well. So you can see what it looks like in 2 months after the treatment. So that's the end of our presentation, and thank you very much.
Thank you, Vincent. That was great. We've got some questions, so I'm going to start running through them. What I'm going to do, I'm just going to make you and I a bit bigger again. Oh, there we go. You've done it. Yeah, that was brilliant. Thank you. Really informative. Oh, good. Lots of nice comments. Okay, so let's start with, so someone's asked, can it be used on the chest area for men?
The only area we can't use is around the heart. So chest we can't do.
No. Okay. And why is that?
Because obviously we don't stimulate the cardiac muscle, and also for patients with underlying heart diseases like arrhythmia or anything like that, they may not know they have it, so we don't want to do that. Yeah.
Okay, perfect. Great. Okay, so if anybody has undergone angioplasty, and they said stent, I think you mean, and if a stent has been used, can you use Tessiforma on that patient?
It depends on the material of the stent. If it's not metallic, then yes, you can.
Okay, cool. But yeah, again, like anything, you would take a really detailed medical history, wouldn't you, anyway? So
anything metallic within the body, you shouldn't be having that.
Okay, cool. And actually on that, someone else has asked, can it be used with a coil and copper T? And I think what they mean is if a patient has a copper coil contraceptive device fitted.
It depends on which area that we're treating. So say for example, if we're treating the arms, then that shouldn't be a problem. But if we're treating the abdomen or anywhere near where it is better to remove it.
Yeah, okay. Okay, after having a baby, so how long after having a baby would you be able to use, do the treatment on a patient?
Once the area has healed, then you're good to go.
Okay.
So as soon as you've recovered from childbirth, that's it.
Okay. Someone's might be a similar answer, but someone's asked, when can we start treatment after abdominoplasty?
So again, same. So after any surgery, once the tissues are fully healed, then we can start with the muscle contraction.
Okay, cool. And that would probably be also involved in whatever aftercare advice that patient has from their surgery or their postpartum or whatever. Yeah. How many supramaximal contractions does it undergo?
So within a 30-minute period, we are getting up to 50,000 supramaximal contractions. So depending on the length of time, so if you do it for an hour, you get 100,000.
Okay. Oh, lots of questions coming in. Okay, cool. And someone has asked, is the number of contractions important for results?
Not well, yes and no. So it is important for the result because obviously the more you contract, the better the results will be. But there are also other factors, for example, the depth of the contraction. So if it is a superficial contraction, if you do it 100,000 times, it's not going to be as effective. Say, for example,
Yeah.
a deeper one, but with 50,000 contractions.
Yeah.
So the two main factors are frequency and the depth of the contraction.
Okay. So I think someone's asked a question about treating with the core therapy setting. So they've asked, how do you choose patients? So I think they're talking about patient selection. So if a patient has a bit of a belly, is there? I know with quite a few of these similar muscle stimulation devices, it's more about superficial fat rather than, so a patient selection basically is what I'm trying to say if someone has a bit of a tummy.
Yeah, so for someone with a bit of a tummy, if their main aim is to get rid of that, then I would combine it with other treatments like HIFU or cryo or anything like that, or even fat dissolving injections. So you can combine it that way. I think if you just use muscle stimulation alone, you are going to strengthen the muscle. But obviously, if there is a layer of fat outside, you can't really see the results, right? And although the treatment actually helps to burn fat locally, if someone has a bit of a belly, it's not going to be that dramatic. So it is combined with other things. And for core therapy, it is suitable for anyone because basically it's just strengthening the core muscles. So whether you are just looking to improve your sports performance or whether you have incontinence issues or anything like that, core therapy can really help build the posture as well.
So, but just managing patient expectations, I guess, when it comes to if someone's got quite a bit of excess fat.
Yeah.
Okay. So in the before and after pictures you showed, someone's just asked, those patients, were they also undergoing a diet as well? So our results connected. So that's just from Testoformer.
Just from Testoformer. So certain patients, those regular gym goers have been going to the gym. Those who don't go to the gym didn't go to the gym. So they just keep to their existing lifestyle.
Okay, cool. Fab. All right. So are there smaller and bigger applicators? And which is recommended to be used at joints, like parts of the body where there are joints? If I use a bigger applicator, is it going to affect end results?
So obviously they're big and small. So the smaller ones would be more suitable for aerosol, actually, and things like that, and thighs. But in practice, I only have the big ones, and I use it all over, and it doesn't make a difference at all. Yeah.
Okay. So even on a slightly smaller area, like near a joint, it still can work.
It still works. Yeah. The only thing that I found is that, say for example, female patients who are quite petite, so even if we're doing abs, normally on a man, I would put 2 of the large applicators. On a petite, small, thin women, I would put 1 applicator in the middle. But in the machine itself, you can actually set so that you can still deliver a very effective treatment with just 1 applicator.
Yeah. Okay. You kind of touched on this anyway, but someone's just asking, is this safe to combine with contouring and other body contouring treatments?
Yes, absolutely. So with anything to do with cryo, so for example, cool sculpting, true cryo, things like that, it is better to do it before Testoformer. Anything else, for example, energy-based thing like HIFU and radio frequency, so on and so forth, you can do it after.
And is that just because if you're likely to be using cryo to target for actual fat loss and you'd want to do that first?
So you can use HIFU target fat loss as well, but the theory behind it is that if we are using cryo, obviously we get vasodilation, vasoconstriction and vasodilation. So it is better to do the Testoformer after the vasodilation.
Okay.
Because obviously with the Testoformer we're generating heat as well. So we have to vasodilate and then vasoconstrict and then vasodilate again.
Yeah. Okay. Fab. Okay, how well, again, we've kind of touched on this, but how well does it work on a patient with a higher BMI?
Again, with patients with larger BMI, obviously the expectations need to be explained and managed properly. Probably a bit of lifestyle advice and combination treatments.
Okay. And then similarly, what about age-wise? So someone's asked if a patient was aged above 40, for example, would it have any impact?
Obviously, with increasing age, our metabolic rate decreases. So obviously, it will work a lot better on younger people. They'll get faster results, more dramatic. But age is not a factor here because we can treat anyone of any age, and they can still strengthen the muscle. The muscle can still gain the strength, but it's just how quickly you get there. That's what's different.
And I guess if a patient is in that age bracket, but perhaps they have quite an active lifestyle and they're quite fit, regular gym goer or something, that then would be accelerated, wouldn't it?
Absolutely, because it varies, because everyone's got different baseline muscle tone, different lifestyle, different metabolism rate. You know, there's so many factors to consider.
Cool. Okay. Okay, someone's asking about price points when compared to another device, which we're not going to talk about another device right now, but definitely get in touch with Get Medical with Tesla for anything about price. We'll put an email address up so you can get some more info about that. Right. So are there any clinical studies, clinical data available online that people can just have a look at to verify claims of the machine?
Yes, we can send it across if they drop us an email.
Okay, cool. So yeah, we'll pop an email down and you can get in touch and you can request that info. We'll make sure we do that at the end. Okay. Someone's asked, someone's asked about applicators again with abdomen treatment. How do we decide whether we should go with one or two? Which combination is most effective? So I know you've said depending on the kind of size and the build of the patient, whether you'd use one or two, but would you perhaps does one combination get better results than the other? Like, would you ever use a big and a small, or two rather than one?
Okay, so by default, I always use two applicators for the tummy. The only exception is when you have a very, very tiny patient. So with two applicators, you can position it differently. So depending on it is a little bit difficult to explain without the device next to me, because within the device, you have different programs that you can tailor to your patient. So depending on obviously the size, what their aim is, what their end result that they want, you can actually really tailor it to that patient. But generally, I would use two, but you can position it differently. So you can either put it side by side, you can put it up and down, you can also treat the back at the same time. So it just depends on what your patient wants. But generally speaking, I would use two.
Okay, great. Okay, lots of questions still coming in. Okay, what about maintenance treatments and how longevity of results? How long do results last?
So once you build the muscle, that's it. You have that muscle tone there. In terms of maintenance, it depends on the patient. Obviously, there's budget and things like that as well. So if the patient can afford and likes the treatment, they can have it once a month after the initial sessions to reach results. They can have it once a month, or if they want to repeat the whole thing in about 6 months' time, they can do that as well. So it all depends on their lifestyle factors, whether they're going to the gym, what they're eating, so on and so forth. But the muscle tone, once they get there, it's there. It's just up to the patient to maintain it.
Okay, so it's not a case of if the treatments are more spaced out that they'll lose that work that they've put in.
Yeah. So say, for example, if someone goes to the gym 4 days a week, and once they get the definition they want, if they continue going to the gym 4 days a week, they're not going to lose the result.
Yeah, okay, fab. Okay, let me just check how we're doing for time. Yeah, we're fine. So someone is asking about, so it was mentioned that the device can contract muscle 100% in contrast to 40% humans can do. Is it safe to go over that 40%? And what's the maximum that you use in your practice? And I guess they're talking about the maximum like contractions, yeah.
Okay, so so with anything higher than 40%, it's called supraoptimal contraction. So this is very effective in terms of building muscles. But obviously, our brain will not necessarily allow us to go up there because obviously it uses a lot of energy and it is difficult to get that kind of contraction. Even in the gym, if you can get up to 100% contraction, because obviously 40% is a guide. Some people are 50, some people are 60. Even if you do get up to 100%, you won't be able to maintain it for any length of time, right? So with this device, we're getting 100%, but we are also allowing the muscle to rest, recover, and rebuild before the next cycle comes in. So yes, it is perfectly safe to go up there, but it is important to let the muscles rest in between contraction.
Okay. On a similar note, in terms of letting the muscles rest, someone's just asking with combo treatments again. Can you do like cryo and then the Tesla form in the same day?
Yeah,
that's fine to do because you explained it's working in different ways, isn't it?
Exactly. So they'll all complement each other.
Yeah. Okay. Fab. So someone just asking about, well, two people actually asking about visceral fat. We've kind of touched on. So is there any possibility that it can work on visceral fat?
I think the effect on superficial fat is a lot higher. Visceral fat is difficult to target. It's mainly lifestyle. But for someone who doesn't have a healthy lifestyle, who doesn't go to the gym, maybe Testoformer would be something good to kickstart on that. But then it doesn't have a direct effect on visceral fat.
So that wouldn't be your go-to for that indication.
Yeah.
Yeah. I'm not sure exactly what this person means. So someone has asked how the number of Tesla is important for EBD devices. If that's your question, could you just clarify what you mean, and then we can. Hopefully you're still here. If you could just clarify what you mean, then we can ask. So about the number of Tesla important.
I think Tesla, if I'm not wrong, is the measurement of the magnetic field intensity. So for this,
yeah.
So for this treatment, I believe it's 3 Tesla, and I think it's the highest that we can get.
Okay. Yeah. Cool. Well, we've had lots of questions, and so I think. Oh, hold on. Okay, we've got a few more. Someone was asking, sorry, can you say that again? The last point. Which point? Which point? And then I'll ask Vincent to repeat it. And then, okay, so someone's asking, what are your recommendations while using applicators for lymphatic drainage?
So within again, when you get the device, when you turn it on, you can have different categories of treatments, and then within each category, there are different programs that you can tailor. So all you have to do is select the right one. The machine does it automatically, and you just have to place the applicators to the area. So okay. It depends on what, again, the patient assessment, so on and so forth.
Okay, cool. So can you repeat the point about when we were talking about EBD and
energy-based devices?
Yeah.
I think. Okay, so with Tesla Former, we're using 3 Tesla, I believe, which is the highest number in terms of measurement of the electromagnetic field intensity. Other energy-based devices obviously use a different measurement because it's a different technology altogether. I guess the best way to make a comparison is with one of the slides I've put in, EMS versus FMS. So the main key points would be the level of increase in creatine kinase, which is a marker of tissue damage, and also the degradation within the area where the applicator touches the skin, and also the depth of penetration, because with other technologies, the depth of penetration actually varies a lot depending on obviously moisture, tissue resistance, skin resistance, so on and so forth. Whereas with Tesla Former, because it's electromagnetic, it actually gives you a guaranteed 7 to 10 centimeter depth of penetration.
Great, thank you. Okay, someone, let me just have a look and see if we've got anything else coming in. Oh, we've just got people just asking for each other's contacts. So I'm just gonna approve them so you guys can talk to each other about that. Cool. Well, I think that is all we've got time for. Thank you so much for all your questions, everyone. I think everyone really enjoyed that, Vincent, so thank you as well.
Thank you.
Do you just want to remind us, actually, I think earlier up someone was asking about where your clinic is, if I'm not mistaken. So do you want to just, oh yeah, so someone was just asking where your practice is.
Okay, so my practice is at Adam and Eve's Muse in High Street, Kensington, and also at number 10 Harley Street.
Okay, so in London, obviously, everyone. Cool. And do you want to just, have we got an email address if anyone wants to get in touch about the device directly?
Yes, I do. Give me 2 seconds. Let me just get Erkan's email up. So it's Erkan, spelled ERKAN, at beautyform.co.uk.
I'm going to type that in as well. So, sorry, could you just repeat it for me and I'll type it?
So it's ERKAN at beautyform.co.uk.
I've done that right. Oh, perfect. Okay. Oh, we've got Erkan here. Wonderful. Okay, great. So yeah, if anyone wants any information about the device, go ahead and send them an email. Yeah. Thank you so much, Vincent. That was brilliant. Everyone's saying thank you. That was great. Oh, just seen one more question. Okay, we've got time for one more. It's fine. So someone's just asked, will Tesla Former work on benign prostate hyperplasia patients?
Yes, it will. Yes.
Cool. Easy. Great. Oh, what's the email for contacting you for scientific? Oh yeah, sorry. What is the email address if people want to get in touch for the clinical? Yeah, the papers. Oh, Erkan as well. Okay, so yeah, we just popped that in earlier. So if you want to just give Erkan an email for if you want to have a look at the papers as well. Fab. Thank you, everyone. Thank you, Vincent. We have 2 more sessions left today, and then we're done with the virtual event. So tune into those last 2 if you want to. Yeah, thanks.